breaking news today, health officials are closely monitoring the rise of a new COVID-19 variant, identified XEC. Detected for the first time in Germany earlier this August, the XEC variant is now spreading rapidly across the UK and the US, raising concerns among global health experts. XEC is a recombinant strain formed from two lineages, KS.1.1 and KP.3.3, with researchers warning it could soon become the dominant variant worldwide. According to scientists at the University of Tokyo's CIDRAP lab, XEC's reproduction rate surpasses that of the currently prevalent KP.3.3, making it a serious contender for global dominance. Health authorities in the UK report an uptick in hospital admissions tied to XEC cases, suggesting the variant's increasing presence. Symptoms of XEC appear similar to those seen with previous Omicron strains, including high fever, body aches, fatigue, cough, and sore throat. The danger, however, lies in XEC's mutations. Two key changes in its spike protein make this variant more infectious and significantly more adept at evading the immune responses developed from prior KP.3.3 infections. This raises alarm about the potential for breakthrough cases, even among those previously infected or vaccinated. Public health experts stress the importance of continued vigilance. Increased surveillance, promoting vaccination efforts, and raising public awareness are crucial steps to mitigate the impact of this rapidly emerging variant. As research progresses, the global health community will need to adapt strategies to confront XEC's potential rise. For now, health agencies urge the public to stay informed, follow preventive measures, and seek booster vaccinations where available. Stay tuned for further updates on this developing story. Time for our studio podcast discussing on the evolving landscape of COVID-19 and the XEC variant.
All right, let's get into it. We're taking a deep dive into the XEC COVID strain today. Everybody wants to know more about this new variant, and we've got some good sources.
Yeah.
We've got this recent article from The Independent, and then some research highlighted on CIDRAP.
Mm-hmm.
Seems like the big thing that's got everyone buzzing is that XEC is like some kind of mashup of two other variants. And some researchers are like, ooh, this could be the next dominant one.
That's right. Yeah, it's what we call a recombinant variant, meaning it's basically a blend of KS.1.1 and KP.3.3.
Oh, wow.
So essentially you've got the virus kind of swapping genetic material and creating a new version.
So it's like the virus is
It happens
mixing itself.
naturally.
Okay.
So it's not necessarily a reason to panic right away,
Oh, crap.
but it's something to keep an eye on.
I see.
And right now, in the US at least, the main variant that's going around is KP.3.1.1.
Correct.
But XEC is increasing and making up about 10.7% of the sequenced samples.
Right. So it's gaining traction.
Yeah.
Where did this thing even first appear? Where'd it come from?
It was first identified in Germany at the
Right.
beginning of August.
Okay.
And from there, it spread to other countries, including the UK and the US.
That makes sense.
Mm-hmm.
And one of the first things you always want to know with the new variant
Yeah.
is how easily it spreads.
Right.
What have we got on that? What are our sources saying about XEC's transmissibility?
Well, research from the CIDRAP lab is suggesting XEC has a higher, what we call a reproduction number, than the current dominant variant globally, which is KP.3.1.1.
Okay.
And this number basically tells us
Yeah.
how many new infections on average will each infected person cause.
Right.
So a higher number
Means
means,
to spread.
yeah. So XEC could be even more contagious than what's out there now.
That's what the early data suggests, yeah.
Wow.
The researchers even think they've pinpointed a specific mutation in XEC
Oh, really?
called SF59S.
Okay.
And that might be contributing to this higher infectivity. Interesting.
Yeah.
So the Independent article, it lists out the symptoms.
Yeah.
High temperature, aches, tiredness, cough, sore throat, all the usual suspects, right?
Pretty much, yeah.
Are we seeing anything different with XEC?
Nothing really, no. So far, there's no indication that it causes significantly different symptoms from other recent variants.
Right.
And of course, all of these symptoms overlap with the common cold and flu.
Always fun to try to figure out what you have.
Exactly.
But how about XEC's ability to dodge our immune systems?
Right.
Whether that's from a prior infection or a vaccination, that's always a concern with new variants.
Absolutely. That's a big one.
Yeah.
And the research has some really important insights on this.
Oh, okay.
Studies show that XEC displays higher resistance to something called KP.3.3 sera than to KP.3.1.1.
Okay.
So that means that antibodies from people previously infected with the KP.3.3 variant might not be as effective at fighting off XEC.
So practically speaking, does that make reinfection more likely?
And it could, yeah.
Even if you've had COVID recently?
Even if you've had it recently, yeah.
Wow.
This suggests there's a higher chance
Yep.
of getting reinfected with XEC.
So is this where vaccines and boosters come in?
I think so, yeah.
The independent article mentions the UK's autumn booster program, which seems really relevant now.
Yeah, I mean, it really underscores the importance of staying up to date with vaccinations and boosters.
Yeah.
While XEC might be better at evading immunity, vaccines still offer significant protection against severe illness, hospitalization, and death.
And as far as protection goes, the independent reminds us that while isolating after a positive test isn't legally required in the UK anymore,
Yeah.
the NHS still recommends at least 5 days of avoiding contact with others. And if you're around vulnerable individuals, it's best to stay away for 10 days.
Yeah, it's all about minimizing risk.
Yeah.
Even though these recommendations are voluntary,
Yeah.
they're still really important for protecting those who are most vulnerable.
Exactly.
Yeah, it's about kind of taking that multi-layered approach to protecting ourselves and others.
Right.
You know?
Yeah, it really makes you think about how
Yeah.
individual choices can really have a ripple effect on the community.
For sure.
Circling back though
Yeah.
to the UK's autumn booster program, who exactly is eligible for that right now?
Right.
The independent article mentions a pretty broad range of people.
It is pretty broad.
Yeah.
So it includes people over 65.
Okay.
Those aged 6 months to 64 with specific health conditions,
Got it.
residents of care homes, and frontline health care, and social care workers.
Okay, so that's
That's a lot.
a big chunk of the population.
Yeah.
Wow.
It is.
It seems smart though.
Yeah.
Especially with what we're learning about XEC
Right.
and its potential for evading our defenses. It's
Trying to stay ahead.
trying to stay one step ahead of the virus.
Yes, absolutely. This highlights that
Yeah.
the pandemic's not over,
Right.
and we've got to keep adapting to these challenges
Yeah.
as they evolve.
Okay, so let's do a recap for our listeners just to make sure we're all on the same page.
Sounds good.
What are our key takeaways
Yeah.
about XEC?
So first of all, it's a recombinant variant.
Right.
It's a combination of two others,
Yeah.
and it could potentially become the dominant strain
Right.
globally.
Globally. All right.
Secondly, early data suggests that it might be more transmissible than what we're dealing with now.
Okay.
And third, while its symptoms are pretty similar to other variants,
Right.
XEC seems to be better at evading immunity,
Right.
whether that's from previous infection or vaccination.
Okay, so potential for dominance.
Right.
Similar symptoms. Possible increased transmissibility and immune evasion.
Yeah.
What else?
The importance of staying up to date
Right.
with vaccinations and boosters.
Couldn't agree more.
Yeah.
Now here's a thought
Okay.
for you to ponder.
All right.
With XEC potentially on the rise, what personal precautions
Yeah.
or preparations
Right.
might you want to consider?
That's a good question.
It's something to think about
Yeah.
as we navigate this constantly changing situation.
It's all about
Yeah.
being informed, prepared,
Yeah.
and proactive.
Yeah, we can't control the virus itself,
Right.
but we can control how we respond to it.
Exactly.
That's a great point.
Thanks.
What stands out to you from all this information about XEC?
You know, what strikes me is
Yeah.
the potential impact on holiday gatherings
Oh, yeah.
and travel plans.
Yeah.
I mean, people are looking forward
Yeah.
to spending time with their loved ones,
Right.
and this new variant,
Uh-huh.
it could really disrupt those plans,
Right.
especially if it's more transmissible and immune evasive.
Yeah, it also makes you wonder
Yeah.
about the strain on healthcare systems if we see a surge in cases.
Absolutely.
Yeah, it's
I think
definitely
it's something to think about.
something to consider as we head into the holidays.
Yeah.
And it reminds us
Yeah.
that staying informed and making good choices is really crucial.
I agree.
Yeah, it really makes you appreciate having good sources like the ones we looked at today.
Yeah.
You know, the independent gives us that
Yeah.
real world perspective, and then CIDRAP has that in-depth research analysis.
Yeah. I think having both of those perspectives is so helpful
Right.
when you're trying to understand complex issues.
I agree. I think that's a great point to end on.
Yeah, sounds good.
Stay curious, stay informed, and stay well until our next deep dive.
Absolutely.